Okay. So the first thing I'd like to talk about is what a health and law policies approach looks like, and to give some examples. Firstly, health and law policies is defined as an approach to public policies that takes the health implications into consideration when making decisions. It's an approach that seeks synergies with working with other sectors and tries to avoid harmful health implications of decisions that are made in public policies. And so you may ask, well, working with other sectors to look at health implications, is that anything new? Well, the answer is that obviously it's quite an old idea. It received global prominence in the Alma Ata era in the late 70s. It was followed up in Health for All and was an important part of primary health care working across sectors. But in those initiatives, it was very much focused on a limited number of sectors in practice. For example, often there were initiatives with the education sector, perhaps between health and education, to promote good eating at schools, or there was initiatives to grow some vegetables within school gardens. With water and sanitation, there was often a coordinated effort to make sure, as part of a public health approach, people had access to good water and sanitation. And this was all referred to as intersectoral action. And many health sectors, like in Sri Lanka and Cuba, which are very well-known cases for good health at low cost, these societies and these ministries of health managed to use this intersectoral action approach. Now, what is different about health and law policies? What is different is that, firstly, the idea of health and law policies is to systematically look at the decisions being made in public policies for their health implications. And drawing on that definition and drawing on the word systematically, I would like to highlight one or two aspects. First is, with systematically, we're talking about not limiting initiatives to one or two sectors. So if coordination is working well with ministries of education or well with ministries of social protection, like in the case of the modern, the last 10, 15 years, the modern rise of cash transfer programs, we should not stop there. We should also look at ministries of trade. What are the trade implications of importing and giving subsidies to certain types of imports of food which are bad for health? We should not stop there. We should also look at the way planning prioritization is done within local government and within cities, in terms of why are slum areas concentrated on the outsides of cities away from economic opportunities, which studies have shown also very bad for health. So the first idea in health and law policies is that we have a practice that aspires to continue increasing opportunities for intersectoral cooperation, coordination, and possibly intersectoral integration of a vision of health and well-being in society. The second aspect that's different in health and law policies is that we want to consciously aspire to have processes, again, systematic and sustainable. By using the word systematic, we're also referring to the issue of sustainability. Again, in intersectoral action, which is often used in local contexts, you will see many examples of intersectoral projects, maybe even in the countries you're living in, where perhaps civil society has initiated some intersectoral work to clean up a local village. And they run clean campaigns, clean the village campaigns for maybe 1 year, maybe they get some international funding, and then things fall away again. It's not sustained, it's not a part of the way local governance is thinking, and there aren't sustained platforms for cooperation between civil society and across different government sectors. So, a second issue of the health and law policies approach is that we want to encourage an approach which is sustained. And in this manual and in the materials that you will find on health and law policies, there are examples of different strategies to use to ensure that the practice is sustained. So these are some of the aspects of health in law policies that I wanted to draw to your attention and to highlight the differences between health in law policies and between what was formerly known as intersectoral action. The next question I would like to answer is regarding why we've decided to launch this training manual and why we think it's needed. As I've mentioned, everyone knows about intersectoral action, but WHO up until this point has produced lots of scientific material to show the harmful effects of tobacco or the harmful effects of poor agricultural produce reaching local markets and so on. So there's a lot of information on these causes of ill health in the population, in particular disadvantaged populations. However, there has been very little training material on how do we implement a practice that is intersectoral, a practice that is cross-sectoral. I use these words interchangeably because you can use them interchangeably. So we found that in particular after the Global Commission on Social Determinants of Health, which was looking also at how do you work intersectorally to address the social causes of ill health in society, we found after that people were not saying, well, what must we do? We know that we must eat well, we know that we need to have green space, we know that we need to have clean environments. But they are saying, well, what do we do as health? How do we promote these conditions of daily living for people as part of public health? Up until recently, WHO had only produced quite specific material on how do you work intersectorally. For example, there's quite a good publication on water and sanitation, health working with the sector of water and sanitation. There's also some material on how does health work in areas of nutrition, in particular for nurses. But there was nothing that was general. And now with the increasing rise and prevalence of non-communicable diseases, which is very important on WHO and the global agenda and most ministries of health in the world, we needed something that would talk about working with other sectors and be relevant regardless of the disease, regardless if it's communicable diseases or regardless if it's non-communicable diseases. So this manual spans across different health conditions, and it's really talking about for different health conditions, for different settings, what are the ways of working to dialogue between health and other sectors of government, to dialogue also with other relevant stakeholders, whether it's in the private sector or in civil society, and how do we encourage a health practice that is more open to promoting health across the different areas of daily life that people experience. Then finally, the third issue and question I would like to address is, now that we've produced this manual, which was only launched recently on the 25th of February this year, 2015, what do we envisage doing to take forward the rollout of this manual? WHO will be working in 2 weeks' time with a group of institutions that have been nominated by all 6 regions. We will hold a meeting to discuss how to train trainers to use this manual. Following that, each of the regional offices in 2015 up to end of 2016 will hold regional training of trainers meetings where they will develop a broad network of institutions who can respond to Ministry of Health requests for training. Over this period, we also expect we will start receiving, and we have already received a request from Suriname, the government of Suriname, and Caribbean countries to start training National Ministry of Health staff. So the end goal is to use this manual in the training of Ministry of Health staff. But I would also like to point out that it's not only about receiving training just within the ministry, it's also about how ministries of health will use the idea of intersectoral dialogue, which is fundamental to working for health in all policies, how they will use this idea of intersectoral dialogue to take an opportunity from training to bring other sectors in and to start developing a common conception of health and well-being. in many societies in the world, health is seen purely as disease. So when people in the government are talking about the health sector's business, they are talking about the health sector's work to respond to problems of disease. They are not talking about the health sector's work to promote health. The health sector's work to promote health has to necessarily involve how they are looking beyond the hospitals and also into the activities and public policies in broader society, because health is promoted in education, health is promoted in trade, health is promoted in water, in sanitation, and often these sectors are not aware of the health implications of their work. Some of them they're aware of, but others are not aware of, and they may make decisions which preclude people from health opportunities. For example, the pricing and tariff structures of sanitation might be too high for marginalized households to afford, further condemning households who are already disadvantaged to poorer health. So it's very important that the ministries of health, and we will give guidance on that, when using this with the trainers, also use the manual to train health staff with staff from other sectors. And then they can use this process of dialogue to advance an understanding of areas in the other sector that are both promoting health and also some areas which might be unknown to the other sector, also damaging health. And this is part of the policy change process that this training manual can contribute to. So I would like to thank very much the members of EPIPNet for giving us this opportunity to talk about this training manual. And in the transcript of this interview, we will provide information on the website from which the training manual can be downloaded. And in the coming months, we will also be posting information on institutions that have done training courses and can then offer training courses to support ministries of health at all different levels of government. Thank you very much.